in listen mode only to cut down on interruptions. I'd like to welcome our presenters today, Laura Similes and Emily Kagan-Trenchard from Northwell Health, as well as Kelly Rogers from Phase 2. I'm going to turn it over to them now so we can get the presentation started.
Hey, thank you so much. I appreciate it. Thank you guys for being here today. I'm actually just going to take a quick moment to let Laura and Emily introduce themselves, and then I, Kelly, the presenter, will introduce myself. Yeah, thank you for being with us today. We're excited to share the story with you.
Hi, this is Emily Kagan-Trenchard, and I am the VP of Digital and Innovation Strategy for Northwell Health, which means that I oversee all the consumer-facing digital touchpoints from websites to digital signage, and excited to be with you here today to share the story of our digital patient experience journey.
And hi, this is Laura Similes joining you. I am the VP of Digital Patient Experience here at Northwell, a net new role to the health system, just about 5 months old. And I too am excited to share our journey with you at this point.
Awesome, thank you. And I'm Kelly Rogers. I'm the Director of Solution Strategy with Phase 2. We're a digital agency that develops solutions for businesses that advance their digital capabilities. And I have the unique experience and wonderful experience of working with both Emily and Laura on this project. So we're excited to share this with you today. And with that, I think we'll just dive right in and just give you guys a quick or brief look into kind of Northwell in case you aren't familiar. But yeah, it's one of the largest and most diversified healthcare delivery systems in the US. You can just see from the statistics on the slide you know, how sort of vast it is, and that there's obviously a lot of ground to cover here. And I actually, if you guys want to add anything, Laura or Emily, feel free to, but it's just sort of a good overview.
Yeah, one of the fun facts I always love to share about Northwell is that 1% of all babies born in the United States are born into a Northwell facility. So if that gives you just a little sense for exactly how big of a region we serve, as well as how densely populated it is. We really, you know, we're the largest private employer in all of New York State with 66,000 employees. And we really have the privilege of covering an incredibly diverse population of people being centered right here in the heart of New York City and Long Island.
Yeah, I think that's a good point, Emily. The only other thing I was going to share is that over the course of the last several years, the amount of growth that we've experienced in our ambulatory arena is quite unprecedented, and I think reminiscent of what's happening in other areas of the country as well. But historically, where our revenue base was largely inpatient, at sometimes a 90-10, we're now at about a 50-50 in our outpatient to inpatient ratio. And so I think you'll see some of that as we start to build out our digital patient experience. I think it will influence the way we think about a lot of the different things we're going to talk about today, is that our mix is shifting, and how we treat those patients is very much shifting.
Awesome, thank you guys. So yeah, we wanted to kind of get with everyone today and talk about you know, how you can own your digital patient experience. And I know from working with you two that one of the first things that we wanted to do was sort of establish this high level vision. So kind of like if we're doing a step-by-step, like how to own your digital patient experience, that seemed like it was step one. So yeah, do you guys want to kind of talk about that and looking at like the digital transformation of the business as a whole, starting in small pockets? Like, how did you sort of develop that vision for what this digital patient experience would look like?
Yeah, so I'll
go ahead, Laura, you start.
Okay, so I'll take that. You know, I think, you know, one of the interesting things is that from a digital patient experience perspective, up until the last couple of months, we've had a lot of different things going on in the health system that were very sort of, I'll call them entrepreneurial, and initiatives that were really not well understood and didn't come from more of a strategic focus. And so one of the reasons why this group was developed was to be able to really take that proverbial step back and think about digital as a transformation for the entire health system. And in order to do that and do that well, we knew we weren't going to just be able to pick a single feature or a single sort of thing that was highly transactional in nature to be able to do, to really be able to put ourselves on that journey and to really think about the industry and the patient very, very differently. So we started this sort of notion of what does the 360-degree patient experience really look like, and how do we set out, even in our very first stages, to conceptualize how we can touch the most important points of the patient's journey that create friction in our environment today between us and the patient, and start to attack those, and not just pick one or two, but to look completely around the experience. Emily, I don't know if you want to say some more about that, but that's, I think, the 360-degree experience is very important to us.
Yeah, and I just to build on that concept, I think sometimes people think of a digital patient experience as something that's born just out of IT, or something that might be born out of a web team that might be located inside of marketing. And one of the things that is really, really critical for Laura and I to establish early on is that this isn't a transformation that just takes a piece of technology and slaps it on what's already happening inside of a health system. The changes that we need to make, needed to happen on that cultural level. They needed to happen with workflow. They needed to happen with administrative staff, with clinical staff. And so that orientation of this not just being a one-off technical project, but really being something that the entire company was taking on together and was going to touch every single one of us, was really important for us to instill as we built this 360 experience.
Yeah, absolutely. And you guys talked a lot about early in the conception of this, right? Is that you talked about how you needed to meet the patient everywhere they are. And so I remember in the early thinkings, you guys were explaining, it's like you just said, Emily, it's not just one place, it's everywhere. And as we tried to tell that story to others within your organization, we found that kind of a visual was helpful. And so, we developed this 360 view and this sort of story map that I'm showing to everybody now. Is there anything you wanted to add about this this concept and how well it worked in your organization in terms of communicating the vision?
I think a lot of times when people take a look at their one aspect of a health system or a patient journey that they touch on, they can see maybe what came just before them and maybe what will come right after, but they rarely get to see the sort of end-to-end patient journey. And so for us, this visual, but also continuing to communicate about a holistic experience, really helped us articulate to people around the organization that, yes, you might be at the front desk, and yes, you might think that means you don't have anything to do with what happens on the, the payment processing side, or what happens on a find a doctor search inside of a website, but you do. And here is how you're such a critical link in this whole continuum. And I think, again, that really just helped us make it clear that this was something that was an end-to-end journey, as opposed to a one-off project that may or may not impact someone.
Yeah, so two other points. I think the other thing that this really helped us do was start to reinforce the point that digital isn't just something that you do at home or that you do in the, when you're not present at the health system. Yeah. Digital is something, if we're really truly thinking about digital transformation and the patient experience simultaneously and looking to drive real change, that it is thread throughout that entire experience, both before you've become a patient here, engaging you as you become a patient here, once you arrive on site, and then through every visit thereafter. So that point of perpetual engagement and re-engagement, and that this digital experience is present in all of our interactions with patients, was really important to us. And I do think that this diagram helped us to start to articulate that, and to really move from a very transactional and episode by episode sort of way of talking about the patient's journey into one that was far more of a lifelong journey with a patient, where there were these little spin cycles of interaction around a particular episode of care or a particular encounter, but that by all means doesn't define the patient experience.
Yeah, for sure. All right, great. Well, yeah, and this, you guys helped communicate that across the organization. You landed on that vision for everyone. And then, of course, the next question is always like, how are you going to do it? Right? Like, how are you actually going to achieve this? And so it was kind of that question of like, build versus buy, or maybe both. And so I know a lot of healthcare networks might feel like it's safer to invest in a platform that already exists. How did you guys handle that? What did Northwell do?
Yeah, so I'll take the first crack at this one. The reality is we started this journey probably over a decade ago with a whole lot of visioning around what we wanted to look like as a health system, both clinically and operationally, and how we wanted to sort of start to stand up a different level of infrastructure, and made a tremendous amount of investment into our, I'll call it the behind the scenes infrastructure that our employees use day to day. And that has been long, tedious, expensive, hard to do work, where we've effectively attempted to standardize and normalize all of the interior applications that we do to do our day-to-day, and that this digital experience, in order to be able to do this well and effectively, we needed to create a foundation on top of that very complicated, unique, and special infrastructure that we have here at the health system. But that work has been in process for a really long time, and I do believe is going to be a critical success to our story. So the way we started this journey with our own internal stakeholders was, we've made a lot of investments into our internal infrastructure, and while that has been expensive and a tremendous amount of capital, we still need a few more pieces between us and the patient to really deliver on a patient experience. And so we spent some time articulating all the good around what's in our infrastructure today, what needs to go into the middle to expose us out to the patient, and then what some of those things on the outside could be in terms of features and functions. And that story seemed to resonate with folks, and we believe truly helps set us up for a good future. Now, the difference between going out and buying or building the front end, if you will, or the front door to the customer, we really don't believe that there's something out there to go buy that does what we expect it to do. There's lots of different kinds of products out there right now that do pieces of what we're talking about, but we have yet to find one that does it all. So we sort of landed on this what I'll call a hybrid approach, where we're building and customizing what doesn't exist, and what we think is going to sort of just define and differentiate us, and then we are buying the piece that already exist in nature, because it doesn't make sense to build those. So I don't know if you want to add to that, Emily, but that's kind of the high level gist is we're not buying or building, we are in fact doing both here.
Yeah, and I just want to build on that by saying that this hybrid approach is one that I think more and more systems are actually going to have to take for a couple of reasons. First of all, not a single one of us can afford to act like a startup. We can't simply shut down our operations and, redo our systems end to end in order to do an overhaul of, every single touch point. We really have to be able to build the plane as we're flying it here. And so that means, a lot of these solutions that you might find off the shelf will come with these assumptions that you can really rip and replace, which is not always going to be possible. So I think any time you're looking at a build versus buy equation, you really have to say, what do you have in place that is mission critical, and how can you have things sort of stack on top of it? And that brings me to my second point that sort of builds off of what Laura was saying, is that there's really not a ton that's out there on the market. Every single one of us in a healthcare system has a very unique mixture of EMRs and scheduling and billing software and CRMs, et cetera. And there's never going to be a time when you have one product that already integrates, perfectly with your particular mix of back-end systems. So there's always going to be a degree of customization. And I would argue in this era of the importance of brand, you're always going to want to customize your front end so that it feels and looks like you, your own unique health system. So when you consider the fact that you're already going to have high costs for integration to your particular backend systems, and you're already going to have the costs for building your own front end, and then you add on top of that licensing cost, you have to start to wonder, which pieces of that truly make sense to buy off the shelf, and where have you essentially re-engineered something you took off the shelf just to get it to work with your world. So I think it probably will be the math might add up similarly for you all as you look to take the same kind of journey. But I would recommend just keeping an open mind to the capacity you might need to be building in-house for some custom software development on this front.
Yeah, for sure. And just to echo that from kind of the point of view of the architecture for the system and thinking about this, I remember when we first came in, it was clear, like what Laura and Emily are saying, that these two things couldn't be mutually exclusive. There was this, we needed to use the standard existing infrastructure, but then the system needed to be flexible and agile. It was obvious that in order to create a seamless digital patient experience and take them through that journey in a way that sort of delighted them and got them everything that they needed, that we were going to have to integrate across a lot of existing best-in-breed tools. So from the beginning, even just our architecture sort of reflected that need to be agile and to be responsive, and then also to use what existed, create the best possible solution for each touch point. And then also keeping in mind throughout the entire process, we wanted to build to scale and grow to meet the long-term vision, because it's going to continue to change. I know, Emily, you talk about this a lot, like the two major trends that we're seeing in healthcare today, consolidation and diversification. I don't think there's going to be an end to needing to adapt and constantly change your system in order to meet the patient where they are and to enhance their experience. So I think that's how we came to the conclusion, like, how could you possibly create one product that's everything to everyone in this dynamic, ever-changing business? So instead of looking for some silver bullet or some one product solution, we realized that it was going to have to be both. So yeah, all right, great. Kind of moving on, and yeah, just to talk a little bit about, those requirements. It's the use of standardized existing infrastructure, that flexible, agile system, the ability to integrate with the existing best-of-breed tools, and basically just being able to build it to scale and grow for the long-term vision. So yeah, once we kind of settled on that, then of course we had the task, as you will with any sort of digital transformation, of generating some internal alignment. And so I wanted to throw out there to both Laura and Emily, how did you go about getting everyone on board and understanding the goal of this DPX initiative?
Yeah,
that
so
they could own it too. Go ahead.
So I will say that is a big statement to say everyone is on board. I think one of the things, one of the things that, we know very, very well here, we're still very early in this journey, is that this is probably one of the first initiatives that we're going to take on in this regard, where the technology is actually going to be ready before the people and the operation is ready for it. So in this regard, I'm going to take on scheduling for a second. Our biggest problem right now from a health system perspective is probably just in terms of access and availability of our providers. I mean, we have providers that are, greater than 75 days out for their first available appointment, and transitioning those providers into an environment where they are comfortable making their calendars exposed and available in a transparent way and in a direct schedule and direct booking kind of way is probably one of the largest change management initiatives we're going to undertake. So we are still very, very much in the process of this internal alignment and quote unquote getting everybody on board, but we're going deliberately with the approach of we have new customers in healthcare, and it's ironic that we're looking at them as new customers, but the patient really is the one driving everything we're doing right now, and the voice of that customer and what they want and what they need is at the forefront. So we have to stop talking about what our providers exclusively want and what is comfortable in the way we run our operations and the tradition of how we run our operations, and we're taking that all very, very seriously and head on right now. So we are deep in the throes of this internal alignment. There's no doubt at the from the top down that this is something we want to do, and that we need to do, and that there's a lot of passion and energy going into it. But we are deep deep and down and dirty in the process as we speak.
Yeah, and I'll add on to that I think one of the ways that we actually started to get people to recognize the imperative was, I think people can say we need to put the patient at the center, but let's be honest, we work in a business, and I think really what started to catch the attention of senior leaders was being able to clearly articulate both the competitive threat as well as the from inside the industry, from other healthcare systems taking on this type of initiative, but also the external threat from the ZocDocs of the world and from other systems which are really going to become the place patients turn to if we as health systems don't respond to what our consumers are really asking for. And so I would say, from my vantage point inside of the marketing organization, being able to articulate the financial bottom line that is associated with both, the threat of not pursuing this type of digital transformation, but also the opportunity it creates once you do have the digital infrastructure to deliver care and services online, really drove home the imperative to say, hey, look, we know it's going to be tough to get, the culture change for the docs or, the realignment of IT systems, but we have to do it. This affects the bottom line.
Yeah, and I'll build on that point, Emily. I think that even went into, just taking a look at some of our statistics with a new, fresh set of eyes and a fresh set of, sort of perspective. So one of the things we did, particularly in the scheduling space, was about 2 years ago, maybe almost 3 now, we opened up a call center that takes in about 70% of our calls and has the ability to schedule into about the same percentage of our provider schedules today. And so for the pilot practices we're talking about, we simply did some analysis and said, hey guys, we are talking about practices that are 100% using this centralized call center right now, and we'd like to just take a wild guess. We'd like you to take a wild guess at how many appointments are actually booked by the call center versus them acting as a message service to the practice. And I think everybody across the board was really shocked at what those numbers looked like from a specialty practice perspective, and maybe even more shocking from a primary care perspective. And those numbers really started to represent waste in our current environment, opportunity, and ultimately that turned into a call to action. So there's some things that we have these numbers. We've always had these numbers, but using them in a slightly different way has allowed us to start to open some doors and start some dialogues in a very different fashion. And that is part of what's at the heart of us, building internal alignment. The only other thing I'll mention around internal alignment that's been really important in many of these conversations is listening very carefully to the interior customers as to how this digital experience is going to interface in the face-to-face experiences and into the practice workflow and into the hospital workflows, and making sure that the data flow is seamless and clean, and that we're not asking our employees inside the house to use different tools, that their workflow is in their core systems, and that anything that they need is really embedded into their workflow, so that they're not going out into yet another system, or they're not going out with another password, or they're not trying to manage another workflow. It's just all seamlessly integrated, and we knew that was you're going to add a little bit of effort, but the viability of the solution would be so much greater, and the experience for the patient would be so much greater, that we're investing a lot of time and energy in that. And that has been a change from, I would say, a lot of initiatives in the past for us, where that gets deprioritized or scoped into a later phase, and then somehow that later phase never comes. But that has been very important and intrinsic to our experience, and has really helped the internal alignment.
Yeah, for sure. And I love this quote, because I really feel like throughout this process, and for anyone who's going to be undertaking something like this within their organization, you will sort of be a pioneer. It's a slightly different way of thinking of things. And I think that, you know, as you kind of heard from everyone, or for both Emily and Laura speaking earlier, like it's definitely going to be a fascinating journey, but I wouldn't say it's always going to be easy. And, you know, you can just see from kind of the statistics how much this impacts, right? Like you know, to the points made, like it's impacting everything. And I mean, different co-development projects, working across teams, like Laura was saying, just being sure that they're seeing the statistics, they understand that this is all in service of a competitive advantage, the reasoning behind it. That's how you can move this many people working on this many things at once, all in the same direction. So, and you can see how far reaching a project like this can become very quickly. And so alignment, I think, is incredibly critical. And to all those points made, that's one of the ways you can do that. And just making sure that people are understanding their different parts of this. And to Emily's point, making that sound argument around why this investment is important. You're going to need that for different stakeholder groups. You need to help the people in, you know, working with the technology understand why it's so critical that we have that piece of data so that we can expose it to the patient. And that's going to impact you at all different levels. And keeping the continuity with that is definitely going to be at the forefront of everything you try to do. So I remember early in the project, we also were thinking about how do we make this a valuable experience? Like, we want to delight the patients. We want to meet them where they are. We want to take into consideration their entire journey. But then the question is, at the end of the day, did we make it valuable for them? And so I kind of wanted to just ask a couple of questions and kind of get your thoughts, Laura and Emily, about maybe some of the differences that you guys feel like you came across in building a digital patient experience versus kind of a customer experience platform, and how you went about trying to generate value for a patient.
Yes, I'm going to let you take this one, because this one I know is an exciting piece of your world.
Yeah, this is near and dear to my heart. So, you know, my team comes from a software and web development background, and we often use the term minimum viable product. And minimum viable product means what's the smallest thing that you can deliver back out to who's ever requesting the software without, you know, over engineering it or putting in too many features, but making sure it still gets the job done. And while we like that concept, in this instance, in approaching the digital patient experience, we really wanted to create a minimum valuable product. And what that has meant to us is that it's not just one task that you accomplish, right? We could have just said, hey, let's just do online scheduling and knock that out, and that could have been viable. But was that valuable if you scheduled online, but all your paperwork is still on a clipboard when you get to the office, and the bill payment portal still stinks? You know, how valuable really is that if you're starting to do this incrementally with a piece that doesn't connect into the whole rest of your experience of going in for that single visit? So for us to construct a valuable product and to really give value, the very first thing we did was to say we needed to start with the patients and what the patients wanted, and hook deeply into that mission, whether we were inside of IT, whether we were inside of a revenue cycle process, whether we were inside of you know, a physician practice group. We wanted to make sure that everybody understood what we were going for, and wanted that entire experience to really feel transformative for the patients end to end. And quite frankly, that makes it feel transformative for our staff end to end. One of the first things that we started with, as Kelly was mentioning, was a mission statement that talks about how we see people, not pixels. And that mission statement orients every single one of us in the sort of end goal of seeing the humans behind the system, and not just seeing the sort of business needs or our organizational structure or our billing need, but really understanding, what does this mean? And, as Kelly has up here on the screen, when we talk about healthcare and we hear about healthcare consumerism, sometimes we can default into this thinking that consumerism really just means like, well, let's just make it push button easy and it should be super cheap and we should just make everything faster, better, cheaper, and more disposable. And that's the opposite of what we want to do. Our mission is to create a platform that actually builds moments of empathy and connection, both for our patients and for our healthcare providers. I'm sure we're not alone here in saying that, as EMRs rolled out, our physicians and our nurses felt like they were spending more time just charting than actually delivering the type of person-to-person care that was so important to them when they chose to go into this profession in the first place. So one of the core goals that we have is for this project to add value back into the lives of our care providers, add value back into the lives of our patients, and build moments of empathetic connection.
Yeah, and I think our organization has such a strong passion for this digital patient experience transformation that we were really given a luxury not to have to spend months and months and months before getting started on this, developing what traditionally, to get the kind of capital we're talking about, would result in ROI analysis and deep statistics and numbers. That the feeling was so strong that the value here was intrinsic and logical, that we just got to get started, and that this first couple of things in the initial pilot, we're not kind of bogged down by the traditional notions of ROI and value. We're free to create, and we're free to find value and build that value in a very, very meaningful way, and driven around the patient as a customer. And I think that's a theme through this entire journey that we're on right now, is that we're thinking about things slightly differently. We're looking at value differently, and we're not bogged down in what many of our original and traditional initiatives have been, including regulation. This is probably one of the first heavy capital investments that's not driven by something that the federal government or some other entity has told us we need to do. So we're really looking at an opportunity for innovation, to use technology in a way that's going to put the patient back in healthcare, and to build transparency and value in a very different way. And I think it's really interesting. I had an opportunity to read some of the remarks made over the last couple of days down at the HIMSS conference by the CMS administrator, and the amount of parallels that are in that speech, and some of the things that are going on are just tremendous. So we feel really good that we got in front of that, and that we're feeling pretty good that our strategy and all that we're thinking about is, it's not just us. There's a call to action nationally seeming to happen as well. So we're pretty excited about all of those parallels.
Yeah, for sure. And I remember you guys making that point a lot early on when we were talking about how a patient isn't your traditional consumer. To Emily's point earlier, you can't just take some solution that was made for like selling retail and apply it in those cases. So you're going to have to really think about the patient. And some of those tenets are important, but one of the ways that we got ourselves in the mindset of this patient and the importance of knowing the patient is that pretty early on, we thought about not only what would be valuable, but how is a patient operating in a digital experience space different from maybe just someone shopping online, right? And there's lots of good things about the ease of use and tracking, and to Emily's point, like they're people, not pixels. Like there's a lot of that pixel work that's really great for understanding more about what your users are trying to do. But in terms of kind of upping the level a little bit and getting into like what is a patient experience really about, one of the ways that we tried to practice doing that early on and understanding the experience both as it existed and what we wanted in the future was around like empathy mapping. So when you think about your patient, which is more than a consumer or more than just somebody buying something, you can think about, okay, I know this person wants to pay a bill, right? But how are they interacting in order to do that? What are they thinking when they want to pay a bill? Like what you realize very quickly is that it's not just about like, sometimes it's check that box off the list, I don't have to worry about it anymore, but there's like other aspects of that. What are they feeling? When we pay for our healthcare, we have a slightly different experience of what that's like. What we see should be a little bit different given what we're thinking. We might be thinking maybe we're doing it on behalf of a loved one, and there's a lot of thoughts and feelings that go into that. There's also things that we're hearing, like what am I hearing as I'm engaging with this digital platform? Sometimes it's something relevant to healthcare because someone's telling you about, their experience, or you're trying to tell someone about your experience, but it could also just be like you're dealing with a lot of other stuff. If you're meeting the patient where they are, sometimes that means meeting the patient when they're trying to pay the bill at 6 p.m. while they cook dinner for the kids and they're worried about everything else going on around them. So when we imagined this product and we focused on value and how we were going to build this, and we also focused on how important it was to think about this person as a patient, we found that the empathy mapping was a really great way to uncover what this product needed to be for them in all the places that it needed, that they needed it. So thank you guys. Yeah, anything else to add?
Yeah, the only other thing I will add is that we believe that this empathy mapping was something that we, and you may have said this, but I just want to reemphasize the point that was not only in sort of the transactions and what the patient was going to be doing digitally. That sort of framed, obviously, the experience that we wanted to create, but we wanted to think really creatively about how do we take that empathy and share it in our human-to-human interactions with the patients too. How do we progressively learn about the patient in different ways, and then share it in a meaningful way at every point with the appropriate person, right information at the right point in time, in the right workflow with the right person who can actually do something about it. So that's an important notion that sort of transcends this digital experience into one that's a very human connection oriented experience. And that's another piece that sort of lives behind this sort of empathic connectivity that may start digital but ends up in something that's very, very deeply human and deeply a much deeper connection than we certainly know how to facilitate today. The only other point I wanted to point out is that this whole notion of is the customer like the customer in healthcare, like the customer in any other industry. And while we just spent a few minutes talking about how they are in fact different, we also spend a fair amount of time arguing the exact opposite point in this organization, because we do have people who just say no in our organization just because it's healthcare. You can't do that because you have PHI. You can't do that because you have you name the reason or you name the roadblock. And when you start to really break things down, that's just so not true. There are other industries that are as heavily regulated with us, that have as heavily sensitive information as we do, that have figured some of this out. So we, as often as we're spending time saying that the patient is intrinsically different than a traditional customer and the experience needs to feel different, and that is absolutely true, we're spending as much time on the opposite point saying that we can use and push a digital experience, that just because we're in healthcare doesn't mean it's not tangible to us. And so I wanted to just draw that out, because while it may seem incongruent, there is a notion that there is a ton that we can do that we just don't, because of tradition and fear that this can't happen in healthcare, and it absolutely can.
Yeah, and that was really how we approached defining success, right? Like all these points were kind of how we established what would be successful. To Laura's point, pushing the envelope for sure on all of the ways that patients could use this. I mean, can you guys think of other aspects that were really important, that we knew were absolutely critical to the success of this digital patient experience?
So other parts that were really critical for us as a brand, again, just putting on my marketing hat for a minute, was to make sure that as we built this experience, it felt like Northwell. It didn't feel like a reskinned version of my chart. It didn't feel like somebody else's product that just we slapped a logo on top of. It really needed to feel like a brand experience and a brand expression. And we've really taken a lot of great pains to make sure that everything from our language to our colors to our animations and interaction patterns all are rooted deeply in what our brand is and what we're trying to build there. So that was a very, very big success measure for us, is to make sure that we really could, at the end of the day, build something that felt like a competitive differentiator. And, some of our brand metrics that we'll be looking at is, do people think more highly of us as a brand for being able to deliver this kind of experience? So that's going to be another measure of success for us. And that dovetails into just one more that I think all of us are in healthcare are really looking at, which is we all want to take the journey with the customer and with the consumer together over the course of their lifetime and really be partners to them in their health journey. So for us, another success measure is going to be, does this make us better partners? Right? Does this make people choose us again and again, and make sure that we're not only there to partner for people when they identify that they need a service from us, but can we be anticipatory? Can we use the tools that we're building to say, hey, this person, hasn't been in to see a mammogram for a mammogram yet this year. Can we send them a reminder, or maybe proactively offer up a couple times and we could schedule that for them? Are there ways that we can be an even better partner along a patient's lifetime and really build that sense of loyalty and partnership with one another through this new platform?
Yeah. And it sounds like you're really hitting on two key points. I mean, there's the brand alignment, being a good partner. It sounds like that, at least for that, the key performance indicators there would be patient acquisition and patient retention.
Yes, absolutely.
Excellent. Anything, Laura, do you have anything to add in terms of how you could foresee the app making lives better, or how it might become a clinical differentiator?
Yeah, I was just going to say, the other area here is that that we're not yet talking about is the fact that we do believe that this is ultimately going to improve outcomes, and that the handful of things that we've sort of touched on as capabilities and or features is intended to be just the first spark in what we intend to do with this app. And so, on the horizon, or how do we take this and start to share information back and forth with patients and their providers directly, so that their medication reconciliation is easier, we have the ability to help them with their blood pressure monitoring and all of the things that are associated with wearables and IoT, and all of that will come. And we believe that at the end of the day, we will improve clinical outcomes, and that's ultimately what we're here for. And that hopefully will create a clinical differentiation for us, not just in terms of the actual improvement to healthcare, but the improvement in the connectivity of our people with the patients as people as well. And we're hoping that sticks, yes, as patient acquisition and retention, but we're hoping that ultimately leads to better outcomes in whatever the patient determines is a better outcome.
Yeah, for sure. And I mean, we're kind of at this moment in time where I feel like I'm hearing everywhere from so many different people how the future of healthcare is going to change significantly. And, to that point, how the app might eventually be used to monitor data definitely leads me to believe that there is somewhere in the not too distant future where the app does help become a clinical differentiator. We're moving into the Internet of Things. It's going to be unbelievable what can be known about a patient, and understanding how care is provided and whether that care worked or didn't work. We are going to have so much data at our fingertips very soon to be able to understand that. And so I think that's absolutely a goal ultimately, and a way that we could define success.
Yeah, and so I think, just playing off the data point, I think the other thing here is that every discipline within healthcare is so different, and our goal is to establish a platform that accommodates it all. And so Emily and I, we don't intend or desire to be the only ones sort of innovating and pontificating about what's the next area to tackle. What our hope is here is that we can create a platform that's interchangeable and can be built on, and that almost every individual in this health system can be taught to think about what they do on a day-to-day basis and how digital can support them. And we'll hand them the playbook as to how we can do that and how they can connect through this patient engagement layer, and that we'll start to connect thing after thing after thing after thing to it. And while I can't predict necessarily what those things are going to be, we're calling upon our organization to be looking at their business processes every day to say, what are those things? So, soon there will be 61,000, 62,000 other people, ringing our phones saying, here, we have this idea. What do you think? And we'll be, in a position to be able to start leveraging those ideas and plugging those ideas in. And that's the notion behind the tool set. And that's where we'll start to see some of this stuff that Kelly is talking about really start to take some shape.
Sure.
And it's exciting.
It is exciting, and you guys have always emphasized, and I love this, especially from the perspective of digital transformation. To what Laura just said, it's a great final thought for this idea of owning your digital patient experience. We've always emphasized this idea of collective ownership. Right. And to Laura's point, new ideas are going to come out of all sorts of places. You're going to have 65,000 people that have new ideas. And it's a collective ownership where you bring everybody into the fold, where they feel like they own a piece of the digital patient experience as well. And that seems like that's a really great strategy for informing cultural change. Any other final thoughts that you guys have on that? And then we can take questions.
Yeah, I would say it's not just ownership amongst all the various stakeholders inside of our organization, which is critical in getting this started, but it's also shared ownership with the patient. Mm-hmm. One of our big goals was to make sure that the profiles in our digital patient channels weren't just one way. There are some things for which our patients are our source of truth, and they have to be able to give us that information, to edit it and update it, to change their minds about something, or tell us that there's a change going on in their life, and that we trust them when they tell us those things, yeah. And we take it seriously. And if you tell us, do you have different gender pronouns that you're now using? When you show up at the front desk, we should use your preferred gender pronouns and not, put you in an uncomfortable situation. It's the little things like that which are going to show that true partnership, which is going to build the trust needed to provide that sort of deeply engaged care that I think everyone in the healthcare system wishes we could find ways to enable. So Absolutely.
Yeah, just play with
collective
that point.
ownership.
I just want to play with that point for a second, because I think it's an area where it really exposes that the change management is not just change management within our organization, because we're partnering with a number of different vendors, as we said early in this process, around buying or building. And so one of the tools we're buying is a tool to help us create a completely digitized and sort of at-home experience related to forms collection. And we've repeatedly find ourselves in this conversation with this vendor that we need to put a gate between data that the patient gives us and our systems. And we're pushing back and saying, no, 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 no. If a patient tells us that their address has changed, we want that address to come immediately into our systems and change our core source demographic on that patient. And they're saying, what are you, nuts? That patient, that hasn't gone through any validation, it hasn't gone through. And we're saying, no, 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 no. That patient is the best source for that information. We have mechanisms to check it, and we will execute those checks, but those processes are already in play. Don't put another workflow in front of it, and don't pretend that we're better at collecting a patient's address or communicating a patient's address than the patient is. And that's a very simple example, but that's us telling the vendor that doesn't work anymore. In addition to telling every one of our registrars that, yep, you didn't collect this address, but it's still good. Use it. And those are, that may seem so simple, but I got to tell you, it's been an interesting exercise to go through those conversations, both internally as well as externally.
That's great. All right. Fantastic. Thank you. So yeah, I just wanted we can take a moment and kind of open it up, answer a few questions.
That's great. Thank you, guys. That was wonderful information. So at this point, we do have some questions coming in for you all. Again, if you have any questions for our speakers, please submit them to me, Sarah Huck Thompson, through the chat feature on the right screen, on the right side of your screen. One question we had was talking about organization, getting the organization behind this. To what degree was the organizational redesign required to lead this pivot to digital patient experience to be embraced as a unified and system-wide effort versus just being a marketing or IT project?
I think it was pretty critical to get us a little bit out of our silos. Now, does that mean you absolutely have to have a new organizational structure? Maybe not, but sometimes, one of the great things, when we had our very first kickoff meeting, Laura had new badges printed for every single senior executive who walked in the room, and it removed their old title and put digital patient experience under it. Because we really need everybody to see themselves on the same team of the digital patient experience, as opposed to seeing, what's this going to mean to my cost center and how much credit am I going to get for this versus how much burden is going to be placed on me. And so you probably could do this without needing, full-on changes to the table of organization, but there needs to be some, in my opinion, some symbolic ways where old titles, old baggage, and old lines of authority are sort of put aside in favor of doing what's right by all of the places where you really are going to need to break some glass and put aside old ways of working.
Yeah, I completely agree with that, Emily. And I think, the reality is where the leadership for this comes from almost doesn't matter. It's the enterprisality of inclusion in and cross-departmental alignment that's essential to building out the solution. So, where the leadership comes from and where the organization sort of gets its day-to-day direction and strategy from really could come from just about anywhere. But one thing that I think is clear is we needed dedication. This couldn't be anybody's side project, which is really where the major change came for Northwell. Is that the org change was not necessarily about having to be just outside of IT or outside of marketing, but more in we are dedicating a team to this, and it is not just an initiative. It is a new office, and it is an office that's going to partner with anyone and everyone in this organization that they need to deliver the new experience, but it is going to be their sole focus and their sole job, not just, the thing that they do in their 20% of 100, 120% of a job, if you will.
And this is kind of a follow-up question to that. So to what degree did you have any tension over the ownership, marketing versus IT versus the medical group? Is it all insistent that they are neutral lead for this type of work?
So I think part of the reason why the project is positioned where it is because there really was a call to action that came out of our marketing department, quite frankly. I'm not sure if everybody on the phone is aware, and Emily can certainly speak to this, but we went through a complete rebranding as a health system. Just a short time ago, we were known as North Shore Long Island Jewish to the market, and now we're Northwell Health. And so marketing had just gone through this unbelievable, it's not even fair to call it an exercise. I mean, there's just this tremendous initiative to rebrand this entire health system, and with that came very, very bold brand statements, including innovation and engagement and redefining and transforming the industry. And the call to action really came, are we doing that? Are we doing that by just staying insular in the technology that we have, and letting other people in our own market get ahead of us in some of these digital places? And isn't it the time to start this initiative? They weren't saying we marketing need to do this. They were saying, in order to hold true to the new brand that we just developed, we have to do this. And IT, on the other side, has spent the better part of the last decade setting up the infrastructure to make this happen. But the reality was, in order to make this happen and to take that call out to action and do anything with it, you need the business to be ready and able to take on that change. And so that's effectively, people laugh. They're like, Laura, you've been a VP of finance and you've spent most of your life in revenue cycle transformation. How are you the head of digital? And so it's kind of funny, but I ended up there because what we needed here was culture change and the ability to drive big change in the practices and in the hospitals. And so we really married the best leadership from IT, from business, and folks that had in our organization the experience and success in changing process flow and moving people through big change like this, and digital marketing together to make a comprehensive team to do all of this. So I'd say no. There may be some tension at the lower levels, but I got to say this was a triad that was put together with the best of intentions and has worked quite well. Emily, you agree with that?
100%. 100%. And I actually think it's pretty awesome that, again, Laura, as sort of the holder of the P&L hill, came from RevCycle, right? We knew that marketing needed this. IT knew that they needed to do this too. And RevCycle said, absolutely, this makes sense. And you really get, not just the vision, not just the brand story, not just the technical, but the business case that undergirds all of this. And you put those together, and it really has been a very complementary leadership strategy.
And one final question before we go. In developing your mobile app, do you lean more towards multiple separate apps for multiple purposes, or more towards the one app approach that has it at all? A one app that has it all approach.
That's a good question.
Yeah. I think all three of us are like pretty passionate about this topic. Let me just give a quick high level, which is that we think we need to build a flagship mobile app for Northwell that sits on top of a fundamental platform. Now, whether or not that flagship then will spin off a product to support, let's say, a mother baby interaction or a chronic heart failure management application will happen down the road. Initially, our first thought was we need to build a platform that could support anything, and we needed the Northwell flagship app to be the home for all of our features, and really then let the individualized use cases present themselves, and then really justify the need to spin off an app, as opposed to getting waylaid in 101 specialty use cases and never really centralizing features and functionality against one single platform.
Yeah, the other thing that we spent a lot of time on, and this isn't so much to the individual apps conversation, but it was really in the notion of single sign-on. One thing that was extremely important to us was even in this situation when we have multiple vendors involved and multiple logins that might be required behind the scenes, that all had to be connected in a very seamless single way. So a single sign-on sort of Active Directory-like solution was essential. Inside of that Hallmark app, as Emily just described.
Yeah, and just to add one more point, so you kind of have that flagship mobile experience, the SSO. I think this is really critical to basically execute it the way that Emily was saying. This flagship mobile app on that you can pull other pieces into as those use cases surface, because at least for me, if you have that main, and we're very careful about this, we've worked so closely with Emily and her team to align with that brand, but you get this sort of visual with your patients, with your patient base, if you keep that integrity in the sort of flagship app piece and with the SSO, which allows users to be logged in across all the systems, you kind of create this visual and functional fluency that is shared that makes it extremely easy for the patient to move from one part of the 360 approach to the next one. So yeah, I think that's many reasons to support that approach and strategy for the product. Well, it's many products, but I think you get the point.
Great. Well, thank you so much. We do still have some more questions, and I'll make sure that those get forwarded on to you guys, and you can answer them offline if that's okay with you. We will be sending out an email with the link to the slides and the recording for this, so if you want to revisit the presentation, feel free to. And I want, again, to thank Laura, Emily, and Kelly for your time today. And